I got with me today Evan. He's a rec therapist. Um, I'm doing my little spiel. I just like to go over a few things for those of y'all who are already enrolled with VA. Well, first things first. My name's Donald. I'm a Marine Corps veteran. Worked for the VA for too long now. I think going on 14 years. I'm a transition patient advocate by, I guess, trade, unquote unquote, which means I transition caseloads typically from DoD to VA. And then on top of that, I do for my facility, I do the outreach. I do an outreach committee, and then I go to different events out in the Tampa area, and try to reach veterans and talk to them about healthcare and how we can assist or how we can better help and help navigate the system as well. Um, but as far as my portion goes, and I'll turn it over to Evan. So what I like to go over is a couple of things. One thing is the VA app, and the VA app is just something you can get inside the App Store, whether you have an Android or iPhone. And what that does is, anybody's familiar with like eBenefits or My Healthy Vet, it kind of like merges those two together in one app. The benefits side of the house of the app allows you to see any current claims, what your total disability percentages are, and you can open that up and it breaks them all down as well. Um, Also, any correspondence that's come back and forth between the VA and you with your disabilities will be in there as well, kind of archived. And then on the side of the healthcare portion, it allows you to secure message your providers. And that, with that being said, though, there is a 72-hour business day reply time frame. So nothing emergency wise, because there obviously you have 72 hours business. It could be a Friday, and that will go over to the next week. If you're having chest pains and stuff, just go to the hospital if that's an emergency issue. And then on top of that, also it'll allow you to, if you have an award letter in the system, you'll be able to get that out of there as well. And that goes back on the benefits side. On the healthcare side, once again, back to that portion. It also allows you to, if you have prescriptions, you can reorder your prescriptions through the app, and they'll mail them to you. Um, and then there's also the portion to where excuse me, I started reading text messages that popped up. There's a portion that allows you to, on the app, that allows you to see any payments that are coming from the VA. So if you have monthly compensation payments or any other payments that are coming from the benefit side, they'll list those in there as they come. They're usually there about a few days before they hit your bank. And then also, for those of you who are enrolled in VA, who realize that the VA is kind of, it's hard to get to in some areas. So let's say, like, I'll take the Tampa area. If you live an hour north, like I do, of Tampa, you're not going to be near a big facility. You'll have outpatient clinics, and a lot of times they don't offer everything. So what the VA does to kind of negate that is they allow you to use urgent care and emergency care. Um, and with the urgent care portion, there's a website called www.va.gov find dash locations, and that allows you to go in there and find urgent cares or pharmacies in your local area that are contracted. It also allows you to see like the CBOX and other VA facilities that are around. But you can go and do a Dropbox, and it allows you to see urgent care. It allows you to see pharmacies, to where if you utilize these urgent cares that are contracted, you can utilize it 3 times regardless of your priority group. And if it's other stipulations with different priority groups, it allows you to use it more. But that'll allow you to use the urgent cares. And if they do prescribe you medications, you can also go on there to look at the pharmacies that are contracted as well. Um, and the pharmacies will allot you 15 days of medications, and then from there you can talk with the VA and everything. But neither one of those will issue a bill. If a bill comes from either one of those, you just let them know the VA pays for it. I'm a VA patient. You're supposed to have your, when you check in, let them know you are a VA patient and have your either ID or your VA health identification card, if people still get those. I don't have one, as I say that. But you just let them know and give them your social, and just let them know you are a VA patient, and they'll flip the bill to the VA. The VA, if there's a bill, it will come from the VA to you. Um, Now, also the emergency side of the house, if there's an issue ever, and I'll put the number in here when I'm done. If there is ever an issue where it's an emergency issue, you can go utilize the emergency care wherever you are. And what you do is, upon doing that, you have 72 hours to notify the VA of an emergency issue that was taken care of, or that is being taken care of if you're still in. So I'll use myself as an example. I checked into a emergency room probably about a year and a half, 2 years ago. I was having chest pains issues. They triaged me. They took care of me. Upon leaving, I called this number, which I'll put in there in a minute. And I said, hey, just checked out of the emergency room, and gave my information. They're like, oh, you're in here already. We just got to verify a few things with you and go from there. So if you let the emergency room know that you are a veteran, or if your loved one does, in case you are unconscious or whatnot, just make sure your loved one tells them, hey, he is a veteran taken care of by the VA, and they will notify the VA. They should. If not, you can do that. Like I said, I'll put the number in here in a minute while Evan's talking, and they'll flip the bill as long as it's an emergency issue and that's life or limb. With that being said, I'll get off my little spiel there. From there, and just next is Evan. He's a rec therapist. He's gonna go over a lot of cool stuff that the VA is doing, and I'll let him go from there. I'll put the number in the little box down here.
Sure, thanks, Ben. Hey, folks. My name is Evan. I won't have a camera. I don't know why I've never actually set up a camera on this PC, but that's all right. So I'm also a Marine Corps veteran, and as Donnie said, I'm a rec therapist at the VA. But currently I work as a training and engagement lead for what's called the Strategic Initiatives Lab. A large majority of my job deals with extended reality, virtual reality, augmented reality, and really getting that into care. Some of you may have seen that kind of expanding in VA and seen some pretty incredible stories. I've been on the road, going to all the conventions, VSO events, hospitals, demoing, educating, engaging with veterans firsthand, showing kind of what this technology really can impact. But I'm going to talk to you initially a little bit more about the recreational therapy side. If you haven't heard about recreational therapy, highly encourage you to. Recreational therapy is basically the use of leisure and recreation as a therapeutic tool. You might see it with the National Veterans Golden Age Games or the National Veterans Wheelchair Games, summer sports clinics, golf clinics. You see all sorts of things. I ran an outdoor veteran camp, a 3-day camp where we went outdoors, stayed on site, and was kind of centered around camaraderie. But the big picture is that we are kind of a jack of all trades profession doing a lot of things. And why is this important to you all? Is that across the board, there's a lot of recreational therapists starting to get into the gaming side of things and to start incorporating gaming, XR technologies into that therapeutic approach. And one of the major things that recreational therapy focuses on, or should focus on, is reintegration into that community. We understand that you all are already in this community, already doing these things, and so we want to be able to support that and assist that. We do that through a great many ways. We've got one individual who runs a Discord group and a Discord gaming group out of Tampa. A recreational therapist that's been doing that for actually quite a while now. I'm extremely jealous of his gaming room. He basically has every console all the way back to the regular Nintendo, where veterans come in, they work with him, and it might be working on adjusting the controllers to figure out adaptive needs, maybe loss of function, use a quad stick or something like that. That's our job, is to help identify how to get you back to that leisure and recreation lifestyle that promotes health and well-being, that also supports you in your goals, both therapeutic and life goals. And so we get a pretty cool job, but it has to do with a lot of advocacy from you all as well. And so getting you all aware of this opportunity is really important, and understanding as well, if that's not an opportunity at your local VA, there's still ways to get involved with those services. I talked about the national events. Just because you might not do adaptive sports or something like that at a local VA because they may not have it, does not mean that you're excluded outside of those events. And so we really want you to be aware of that. But then, we do all sorts of things beyond that. Like I said, a woodworking group, we do social groups, we do all sorts of things, but we're really targeting the gaming side of it now. We understand, myself and Donnie, when we were in, definitely played video games. And you come back from patrol and get in the squad bay or something, or with your fire team, or maybe even playing like FIFA or something by yourself. But we use this as kind of that tool to distress and to connect with other individuals. And especially nowadays for me is connecting with a lot of my military buddies via online gaming, where geographically it's just impossible to reconnect with them, but I get to. And so we want to be able to increase that access for folks as the VFW, the American Legion, Regiment Gaming, all of these groups, including your own, are doing the front work. And so we really want that to be aware. And then on the XR side is a really cool aspect. We've seen XR grow in the last 6 years from about 10 facilities all the way up to 170 plus facilities. Every single state, American Samoa, Guam, and Puerto Rico as well, has XR in some capacity, being used from anything from PTSD treatment to stress, anxiety, depression, sleep, pain, and in all sorts of these conditions that us as veterans might be coming in for. We're starting to see XR and gaming start to address a lot of these things. So this is both to have that conversation, hopefully ask those questions around that, but then also to make you aware that this stuff is happening. And I highly, highly, highly encourage you to go into your local VA and ask if any of this is possible, because the most beautiful part is that your voice is much stronger than ours. And if you go into your facility and ask if they have gaming and they don't, and you ask, how do we get that done? That's my role as a rec therapist, is to either connect you to a resource like this, or to find a way to provide those services, whether that be through prosthetics, meaning trying to figure out, okay, well, do we have the means and is this a functional thing towards the goals? That doesn't mean that I can't issue things like adaptive controllers or devices, or get you access to certain things. That's my role as a recreational therapist. And so I don't want to put that in your radar. Also, it doesn't mean I can get you a brand new gaming computer, but I might know somebody out in the community that might actually be able to do so. So it's all about connecting with those rec therapists that are around your location. I am a resource as well. I'm happy to take kind of an email or a quick Discord message, and then I can connect with you via email if you don't want to put it out there. But I'm happy to look into it, connect with individuals, find out who your local therapist is and what they're doing, and report back to you. That's a huge reason that Donnie and myself have been so active in the community with the engagement, is to really, from veteran to veteran, have that conversation and say, you know what, it's not there, but here's some resources. Or, yeah, it's totally there. Here's what's happening in your area. And to teach you how to get connected to those things. So with that, I feel like that's much quicker than the last time, Donnie, but that's kind of a quick down and dirty of recreational therapy. But just know, folks, that this is something that rec therapy isn't just about sports or gaming or anything. It can be all the way to stroke rehab to my first role was unfortunately helping veterans cope with dying. There's a lot of ways that we can leverage this recreation and leisure lifestyle to really show those powerful tools and ways that we could use that for health. Any other things you want me to cover, Donnie?
Oh, no, so I was just going to talk. There's somebody on here that they said, hit me up. I work at the VA as well. I wouldn't mind talking about some of the technologies you are referring to. He left his email. He's a Louisville VA.
Okay.
He's also on the Adaptive Sports Board.
Yeah. Yeah, we might know each other then.
Hey, raise your hand, and I'll add you to the stage.
I also put my VA email in there, folks.
I missed
feel free to reach out to me via
They said raise hand is disabled.
Well, it can be. Hold on.
Hey, Dee Dee, you live an hour north of Tampa. Do you live in Spring Hill?
Yeah, so if you live north of Tampa, you have, like I said, you pretty much have the godfather of adaptive gaming in the VA. That individual runs out of the Tampa VA. It's a pretty amazing facility there, and he's got I'm totally jealous of all his stuff. He's all the equipment, all the VR, all the gaming. And then also a lot of adaptive sports sides of things there. So would encourage you to get a hold of your PCP and ask for a referral to recreational therapy. And then you can mention gaming as one of those, or virtual reality, and that PCP should know exactly what rec therapist.
I was gonna say, Lynn, Total Red said they have a couple questions. If you want to bring them up,
Yeah. Someone is not able to attend tonight. Would love to get their question at some point. Yeah. I'm happy with questions coming in at any rate, any direction you want. So this is your show. Hey.
Okay, so first question is, okay, so I'm 100% disabled, but I don't know that I have the type of disability that would allow me to carry a job. How do I
Mhm.
find out?
What was the question again? I'm sorry.
So he's 100% rating, and he doesn't know if he's excluded from working a job.
Are you TDIU?
I don't know. That's what I'm trying. Where do I find that out? Like, how do I get that information?
You should have an award letter. Your award letter is stipulate if you're TDIU or if you have any, like, so a lot of sometimes I'll say that if you're like 100% PTSD, there might be some kind of like work issue to where you can't hold a job down is why you got the 100%. So there might be something there within that. But typically, unless you're TDIU or so you have something that specifically says you cannot work, then you at 100% you can work. Unless you're TDIU, basically.
Okay, so I just need to get my award letter and make sure it doesn't say TDIU on it.
Yeah, I mean, but TDIU, you should know. You would know. Like, so let me ask you a question: Are you 100% by your rating, or are you 100% because you applied for something else? Like, is your rating? Go ahead.
It's 30%. Or no, it was 10% on my back, and then 80% for mental health issues.
So with mental health issues, I don't want to get down to the breakdown of what you have.
Yeah.
I'm just trying to figure out. So what you're saying is you have an 80% overall. You have a 70 with well, that would still be 70%, 70 to 10, because it goes for mental health. It goes 10, 30, 50, 70, 100.
Yeah.
But if your overall is 80, but you're paid at 100, then yes, you would probably have TDIU in there. But if your overall is 100 and you're paid at 100, then you're 100%. Now, but I would find your award letter, see what your award letter stipulates. If it says TDIU, which is temporary disability, individual unemployability, something to that effect. I may have said those words all wrong, but that's individual unemployability basically, and it stipulates that you are getting paid at the 100 rate. But you are either 60, 70, 90, 80, 90, but there's stipulations with those as well. But yeah, so that if your award letter will stipulate it.
Okay, thank you.
Yep. Yeah. TDIU can work a certain amount. It has to be underneath the poverty level is what it is, but that's a game you're going to play too. So be careful with that. I wouldn't just tell people yes you can work with TDIU. You have to be underneath the poverty level, which could be I think it's like $16,000 a year. But there was also an issue. I'm sorry. Where are they at? I think they left because I was trying to help them out because they couldn't hear anything or anything. That's I'm going to mispronounce this. Izuba Bakau. You're in here.
The voice for the waving sign does work.
You're breaking up really bad there.
What's
Go
up?
ahead, Navy.
Which part? I put 2 parts in there.
Just
had,
fire away.
whichever one.
We don't
Yeah.
have any other questions.
Oh, well, so I know this is our gaming Discord and everything like that, but I do a lot of wind therapy program stuff with different organizations and everything, which is motorcycles.
Okay. Yeah, I was going to ask you. So, like riding motorcycles?
Yep. Like I don't know if any of y'all have heard of the 22 Kill Foundation out of Dallas, Texas. They're now known as the One Tribe Foundation. And me and my dad are actually their road captains. And so we plan, I mean, the last ride we had, there were 950 veterans that showed up.
Awesome.
We shut down all of Dallas. Yeah.
Good.
State troopers, cops, everything. So, I mean, I don't know if that's something that, like,
yeah. So it's not something that we can't do, right? So this will be kind of a political answer. It isn't something that we can't do, but because it will involve motorcycles and all that stuff. What I would say is I would probably recommend you just shoot me an email.
Okay.
And then we can jump on a phone call and get more in depth on how that might look to get involved with that local rec therapy department and get them involved. There's some liability stuff. There's a lot of stuff there. But like I said, we do adaptive sports. We do rock climbing. We do all these things. There's just extra waivers, extra processes involved once we start doing stuff like that. But it's not out of the realm. And I can honestly say, doing this XR stuff, I would say one of the most popular things that I'm asked for is there a motorcycle riding experience? So I think for you and I, there's a potential for a conversation even beyond getting veterans involved with riding is potentially that conversation around how do we get that content into a virtual reality for 80, 90-year-old veterans that live all the way across the country, stuff like that. So definitely a potential, man. And it's not excluded. So I think that's what the really cool part about recreational therapy is, if it's off the wall or something like that, it doesn't mean that we can't do it necessarily. We've had people taking people in riding helicopters. We've taken people skydiving before. So it's definitely a possibility.
Okay. Yeah, that's yeah. I mean, we've got. I've heard of them doing that down here because I mean I'm right next to it's now Fort Cavazos, was Fort Hood, I mean one of the guys in our VFW group, he's a pilot, he's an Apache pilot, and they use him since he's about to retire, but they use him to do all of the rec therapy with the helos and everything like that. So that's how he gets his flight hours.
Yeah, awesome. Yeah, there's some really cool programs we can build. And I think what's so cool about what's, kind of what people are seeing right now is it takes a veteran like yourself to say, hey, what if we did something like this? And then me as a rec therapist, then I get to say, you know what? All right, let's figure it out. Let's find a way. And so that's the cool kind of rapport and relationship we can create in rec therapy. And yeah, man, there's some really good rec therapists out in that area. So I can kind of throw this out to them and mention it, and there might be one that'll jump on it right away.
Awesome.
So yeah, I'll put my email in the chat. I'll just keep re-putting it in there, just send me a email, and then I can start that process. And I think Donnie, you said somebody in here is on the Adaptive Sports board.
Yeah, he was.
So-
Goodness, it was all the way. Let me scroll up and find it.
So that individual will also probably be really interested in that conversation too. So
Yeah, I'm always down to have a conversation about
Yeah,
motor.
Motia 83. I probably slaughtered the name, but
and then Donnie, looks like they put the email questions in there.
yeah, I saw that. So I was gonna go. They got touched on a little bit, but as far as I was reading that first one, which that's
Well, actually, hang on. I jumped the gun. Navy, you got any other questions? My bad.
No, that's all I got. That's all I
Okay.
got.
All right, man. And then I answered your other one directly. So how do you get involved? Just get a hold of your PCP, or the medical center website should have the information for your department there. Sorry, Donnie. I realized I jumped the gun on that one.
Oh no, all good. What I was gonna say real quick is for the one with currently 100% non PNT service connected cancer. If a veteran passes from something that is deemed service related, you don't need that PNT connection. The PNT connection. So after I think it's 8 or 10 years, and you've been married for 3 years, then there's a pension involved and stuff like that. But if for right now, so say a Vietnam veteran got diagnosed with diabetes and or high blood pressure or whatnot and passed away from that because it was deemed related to Agent Orange. If they passed away from that, then there are survivor benefits associated with that. So that's why, when people are like, I'm 100% PNT, why do I need to service connect X, Y, or Z? Well, because there's still a time frame you have to be PNT in order to get that pension from passing away. But if it's a service connected passing, it doesn't need that time frame. So this cancer, unfortunately, he's saying it's terminal, and that's I don't know how to react to that portion of it, but I will say that as long as it is service connected, he can assure that his family will have some survivor benefits associated with that. But just make sure it's a service connected cancer, and that's all you got to do.
Yeah, and I would, if that individual does get care in the VA, the palliative team that he might be working with should be able to answer some of these questions. And then what I would also say is your patient advocate and your licensed clinical social workers, especially in this case, you probably have a licensed clinical social worker. They will also be a resource in this regard to connect you to those things.
I forgot you mentioned that earlier, that you dealt with that stuff.
Yeah. It's one of the most rewarding and the hardest roles I've ever had to play.
I can see that would be rough. And I think they touched on the last one. Trying to read this one.
It's basically was in the National Guard, getting a medical retirement, and asking about TRICARE and how they can go about getting healthcare.
So if you're medically retired in the National Guard, there's I forget, there's different titles, and I think like a Title 10 or Title 15 or something to that effect. It depends on what title you are if you'll get TRICARE. And then as far as Champ VA, that's so if you're entitled for TRICARE, you're not entitled to Champ VA. You can have one or the other. Well, let me rephrase that. If you're entitled to TRICARE, you can't have Champ VA. So yeah, and if that Air National Guard wants to give a little bit more context to his medical retirement, because like I said, you can be medically retired from the National Guard and not have any federal benefits whatsoever, because it's a state level thing, not a federal thing, sadly.
In a lot of cases, they want to seek PNT also for the state benefits before they pass, so that it ensures that if the state does grant the mortgage relief and so forth, that they get that.
So. I got you. Okay, I was just looking at the federal side. I mean, that makes sense completely. Did Chanti Stern have a question?
Yeah, I did. Yeah. So, hey, thanks for putting this together. This is super helpful stuff, even just to kind of listen in and what other people are saying. I had a question about, I guess, combat veteran versus non-combat veteran. I don't know if that's a made up thing, but I've heard people say that there may be different benefits if you're a combat veteran. And so I was kind of looking at my 214, DD 214, and I see on there I have some service, ribbons that for people in the know would know that those are, combat zones and combat locations. But is there something that is supposed to be on my DD 214 to indicate that I'm a combat veteran, or is
So,
that not even really a
combat veteran
thing?
in the VA sense of the term is a very loose term. It's a term that just like if you're eligible for VFW, which is a veteran of foreign wars, you're considered a combat veteran in that essence in the eyes of the VA. So once you get hazard pay, once you get the combat pay, you are automatically a combat veteran. Now there are some so working for the clinic that I work for still working for 14 years. It's it used to be called the OAF clinic. It didn't manifest it into the transition clinic, and now it's a military to VA clinic. And what that did is essentially what they did is they were saying, hey, if you're a combat veteran, you're going to get presumed related care for the VA without being service connected. Once you get out of the military, you are presumed related care with the VA. You have 5 years of it, and then in that 5 years, you can get service connected. Blah blah blah. It was a way to kind of usher the veterans who deployed into the VA and get them going. And that essence, yes, there is absolutely. Well, there was. Now I think it's like a 10-year thing. And I actually tell you the truth, the PACT Act just made it kind of a seamless kind of thing to where if you deploy to these zones, then you're automatically eligible for care through the VA, just like Vietnam veterans. If you have boots on ground, you're automatically eligible for care. OAF, OAF, OND, Iraq, Iraq, Afghanistan, not necessarily. There is other stipulations for Gulf War, but those veterans are eligible for care once they get out of the service now. If you served in those zones and you've been out for 10 years, you're automatically eligible for care now. There is not the 5-year presumed anymore. It's just like the Vietnam veterans. So there's that aspect of it. But as far as other benefits, you have combat specialty pays, which are related to retirement and combat injuries. So there are some type of stipulations like that, but overall, that's what you're looking at.
So do I need to kind of follow up then? So I know when I look at my dad's DD 214, he served from, 69 to 73. On his DD 214, it does say, he served in Southeast Asia. Whatever. I don't have anything on my DD 214 that would indicate that. So if I ever needed to prove combat status or whatever, would I just show them I saved all my my travel vouchers, right? That showed the locations and stuff like that.
That's
if
one way
to
to
do a campaign medal. You'd also have that listed on your DD-214. So if you had,
I've got the campaign medals.
those are going to qualify you as a combat veteran because you deployed into a combat area, or if you received hazardous duty pay, that should be annotated. But yeah, if you have any of the campaign medals related to an action, then that would signify combat related.
Yeah, I'll also throw out here, Chauncey, if you have, I know with the Marine Corps, it's MAR admins. So the MAR admins that come out actually list where you actually deployed to. So you can also reference admins if they're out there that should list where that unit went and for how long. And that should be able to tie in to what you're saying as well if you're having trouble with proving that. And then the VA also has what's called buddy statements. And so I want to throw that out there as well, as there are buddy statements. So if you're ever, this deals with service-related conditions as well. So if you're ever in that where you're struggling to prove because you didn't have the medical documentation or you didn't have that documentation. I was infantry, so of course I did not. I didn't report a lot of things, right? But having those character witnesses and those buddy statements is really helpful. And that is, and there is it's on the website as well, so you can actually ask that.
Cool. Yeah, I'm not seeing on here, any dates and locations on the DD-214, but I like I said, I have all the vouchers. I just didn't know if I needed to, looking at this last comment here for my spouse or surviving, beneficiaries. I just want everything to be seamless for them in the event that that's important at some point. And if I needed to change the DD-214, I'd start tackling that now, I guess. But I still have all those other vouchers and stuff. What's that?
Well, anytime if you get a 214 corrected, you get what's called a 215, DD-215.
Oh, really? Yeah. All right. Learn something new.
Yeah. No, it's a process too. It's not just something that just happens overnight either.
Okay.
And there's certain forms. I'm sure the VSO here could tell you it's certain forms based on how long you've been out for things as well.
Okay.
let's see.
I did have another question, but it's escaped me right now. So when I remember it, I'll raise my hand again later.
Is there any reason to enroll in TRICARE or additional health insurance if you're 100% P&T? Well, if you're eligible for TRICARE, you're not going to be eligible for CHAMP VA. If you're P&T, you're eligible for CHAMP VA if you're not eligible for TRICARE. There. But yeah, I guess that kind of answers its own question. But it's so I guess one thing maybe I'll touch on. So let's take the TRICARE out of the equation. If you're 100% P&T and should I have other healthcare because I can get CHAMP VA? Well, CHAMP VA is sort of an insurance, it's sort of not. It's a coverage. What I mean by that is there's no like what do they call it, PPOs or different. I forget how insurance is what they call those things, different networks. So what it does is it works as an overall coverage. So let's say I just have CHAMP VA solely by itself, and I go to a primary care doctor, not me specifically, my dependents, because CHAMP VA does not cover the veteran, it covers dependents. So my spouse goes and sees a doctor. The doctor bills her for $100. With CHAMP VA, it's going to cover $75, 75%. So that's why I use 100. It's really easy, simple math. Math for Marines. There we go. And so $100 is going to pay up to 75%, because there are some areas that doesn't pay the full 75%, but the vast majority of stuff is going to pay 75%. Even for medication, same concept. So as a primary insurance, it will cover up to 75%. And there's a book that breaks down every single thing it pays for and how much it is and so on and so forth. Now, as a secondary insurance, now I will say this. Yes, CHAMP VA is for dependents. I will say this. If my brain just okay, so myself, I have a wife and 4 kids. If I'm applying for CHAMP VA, all 4 of my my wife and 4 kids, all 5 of my dependents, math for Marines, all 5 of my dependents, I have to do an enrollment form for and other health. It's called an OHI form, other health insurance form. Every single one of those people have to have their own forms. So it's 10 forms completely filled out and turned in. Now, as a secondary insurance, what it does is now having Blue Cross Blue Shield. If I go out there, I have Blue Cross Blue Shield. I go out there, or my spouse goes out and has an appointment. Say same thing, $100. If Blue Cross Blue Shield pays out $50 of that, the fact that it's $50 less, which is under the threshold of the $75 it was going to pay out anyways, it's covered. Same with medications. And what it does is it will pay up to that 75% and as a secondary. So now here's the thing. There is an out-of-pocket cost annually with CHAMP VA, and it's $50 per dependent up to 2 dependents. So if you have 5 dependents and they have things, once you have that $100 out of pocket, then CHAMP VA will cover what's going on throughout the rest. The question is, why would I cover? Because it'll save you a lot, because you don't pay much for CHAMP VA. So if you have other insurance and you get 100% P&T, I think it behooves of you to utilize it, because it's going to save you those copays. It's going to save you out-of-pocket costs. My stepson had a motorcycle accident to where it saved us a lot of money. So it's very beneficial in that aspect. I tried to buy for migraine, but I think it was too, despite me having. Okay, real quick on the individual cooking, I almost called it something else, cooking rel. So with the PACT Act, those are, you said you applied for it. Here's the thing you should do. Go to are you active in the VA right now? Okay, go to your primary care. Ask them for a consult to what's called the RISC. That's WRIISC. And what the RISC are the individuals who do all the studies on everything, for whether it's toxic exposures, environmental health, embedded fragments, Agent Orange. All those studies are done through the RISC. And the RISC, what they'll do, if you ask for a consult, the RISC will call you up or give you a call, like, hey, why do you want to utilize us? Well, I was exposed to X, Y, and Z. I'm having these issues. Are they related? And if they can't answer you point blank, they'll actually they'll call you in and say, hey, we want to do our own studies on you. And they can absolutely do that. I hooked a couple of other people from other servers up with that. And if your primary care doesn't know what the risk is, there is an environmental health coordinator and environmental health provider in each facility that will be able to hook you up with that. Nope. I heard something.
With your decision, it can also depend on how you claimed it. The PACT Act does not cover migraines. They're not a presumptive underneath the PACT Act. So if you were putting them in secondary or under another cause, there are a lot of things that could have led the VA to not connect, especially if it was seen once or twice only in service and considered acute rather than a chronic problem that you're currently being seen for now. So please make sure you send me a DM. If we don't have POA, we can give you some general information, but if you want to establish POA with the VFW, use our free service. Then I can get into the Veterans Benefit Management System, see why your decision was made the way it was, and then we can give you some guidance and help you to potentially get them connected. But it all depends on how it was claimed and under what guidance.
I absolutely follow that. But one thing I would just, anybody who's looking at doing this stuff, if you are able to go the risk route, what that'll do is the next veteran in line, when enough veterans saying, hey, I'm getting migraines, well, now they're going to be able to say, okay, well, now we can put this into a study, and now we can, instead of doing what sorry to say that the Vietnam veterans had to wait 30 years to get for their stuff, we can be on top of stuff for our generations and the next ones to come, to where these issues are popping up. We can get them solidified now. But yeah, absolutely take the VSO's direction as well. But I would ask that you try to assist these future veterans for these cases going forward.
Yeah, I couldn't agree more there, Donnie, because it's going to be a big issue, and the PACT Act is still expanding. So the more studies we have, the more claims that are connected to toxic exposure, the better, to get more things added to it.
I'm gonna jump off mute here real quick because Sapper just touched on something that was absolutely incredible. I know we still got some questions about benefits and everything, but we actually found out early last year that veterans were actively in the metaverse with, and you'll hear my daughter in the background. I'm sorry, hang on. They were actually already in the metaverse, and they created a virtual VA medical center, unbeknownst to obviously the VA, where they actively have counselings. There's a counselor in there that schedules and talks to individuals, and it's all about connecting as veterans. So really cool opportunity, and if you want to get your local VFW involved, highly recommend it because they're out there, and that is something that was organically done, and that's what another reason why we're getting into this space, because veterans are already there.
Well, Didi, I don't. As far as certified, like, is that a licensing issue, or you say you're certified by the VA? My 4-year-old just yelled at the dog. I'm surprised nobody heard that.
So Cooking Rail, when it comes to the claim, if you're within a year of the decision and you haven't put in any other appeals on that decision, you can do a higher level review with a 20-0996 and request an informal conference to speak with a senior rater. And that doesn't require any new and relevant evidence. Or you can use a 20-0995 supplemental claim with new and relevant evidence to support that it is a chronic condition today. And this could be lay statements, additional medical records, nexus from your doctor, so on and so forth, to support that claim and go from there. But again, if you want some help, we're happy to help you.
Well, I'm going to slaughter the name again. Izuba Bakua can actually hear now, so that's good.
Donnie, I think I just want to have you pronounce names from now on.
I slaughter them. I slaughter them completely. Yeah. So yeah, that's what I'm saying. So certified, I would be very careful, because I mean that's even like regular. So when you're talking about healthcare and paying for stuff, they want to make sure you're going to somebody who's certain license and certain certifications for sure. Like I wouldn't be able to have you come to me and say you went to a PhD of any sort. They'd laugh in your face. So, and I don't mean to say that negatively. It's just I'd be careful with, even using private insurance, who I'm going and presenting to. And a lot of people will take the veterans, and I don't say this negatively, because we, as veterans or active duty, we are treated by TRICARE, we're treated by DEERS, to where we are told where to go, when to go, how to go. Then when you get done and start doing it yourself, you really don't know the ins and outs because you didn't grow up in the private healthcare system. Now you're giving somebody, hey, here's Champ VA, go utilize it. Oh, well, this person says they take it. Let me go utilize them. Well, it's a little bit of the naiveness on the side of us. So I would just make sure we're checking in and out, making sure that people are certified or as necessitates.
So, soup sandwich. PACT Act doesn't necessarily mean that you were exposed to gas. It was the specific toxins in the various areas. It's got a pretty clear list. I tell folks that if you think that you were exposed to toxic exposures, whether it be the burn pits or what have you, depending upon the era of the veteran, then you should file the claim for the conditions that you have been diagnosed under. And also do what Donnie is saying and talking to the RIS to help out the other veterans. It may not change your overall rating, but if you do have something like pulmonary fibrosis or other things that are in the PACT Act list for Desert Storm or Desert Shield post 9/11 veterans that you could potentially pass from, then it'll help allow for the service-connected condition if your family needs to be taken care of underneath DIC or other conditions. So those are things to think about for long-term planning as well as short-term. But if you want to have more conversation with it, please just feel free to reach out.
I'll add one thing to that. So, like, I assisted somebody probably about a month ago. He actually had a non-disclosure from the U.S. government for some things, and it ended. I guess he showed me the paperwork. It actually ended last year, and they actually found weapons of mass destruction in Iraq, but they had U.S. made in USA label stuff on it. So they had a non-disclosure for 20 some odd years or 20 years. But a lot of the people within that unit passed away from things. So that's not exactly covered in PACT Act, but it is an exposure to where you could actually, and I led him over to the risk, and they eventually got things settled to where he finally got something set up. But you can use, if you see something, you say gas, like what kind of gas? I mean, there's all different types of gases. I mean, JP5 is a gas, but it's not necessarily that you're going to get, like you were saying, if there's something that you're diagnosed with, absolutely. So yeah, I mean, you could reach out to the risk, and again, back to the 100%. I would always venture to say yes, if you have something that is service related, or you deem service related, even if you're 100%, I would say still go after and get it service connected for a slew of reasons, and then not only that, to help set a trend. So as we age, veterans that are aging and getting these things can actually say, hey, look, the VA is recognizing this now. I didn't know. I'm not pronouncing this one.
Motia.
I was going to say
Moti. It's probably Moti.
Moda.
yeah, that's fine. Yeah, my name's it's actually Mike Nichols. I'm actually at the Louisville VA. So I'm actually overseeing the new hospital we have going on there and some of the technologies that we're putting in. Now, I can't really speak to a lot of the, I guess some of the clinical stuff I do deal with a little bit of it as a biomedical engineer, but not as much as some of you guys have. But I will say being with the VA, that a lot of the stigma is around, when people think, hey, you're disabled for the VA, they think that they're thinking disabilities that you see out there to where you can't function. And what a lot of people don't realize is, you can still have these disabilities, and a lot of them can't be seen, and you can still function with them. And oftentimes, you actually all the time, you are required to be seen for these in order to actually have health care for them. So a lot of people don't realize that. But I will tell you, like I said, I do oversee a lot of the new technologies that are going into some of the hospitals. So we're strides above most hospitals when it comes to technology based. So, all the new AI, all the new security functions and everything you hear about hospitals running into, malware, ransomware, all that stuff. You don't hear about that as much with the VA because we have such stringent guidelines for a lot of things. Being the largest healthcare organization in the world, we do have our pitfalls, but we do a lot of things right. So, serving our vets is definitely our number one mission, and that's something I look forward to every single day.
Yeah, I think you touched on some really, really important topics. I think both as topics as veterans, and then kind of understanding in this. This is why Donnie and I do this, and I really appreciate you jumping in on that because, in case anybody wondered, which you probably don't, but we are the leader with the XR technology globally. The VA is leading the way in healthcare globally with XR technology. We have the largest deployment of that, and we have a lot of capabilities to deploy stuff like that because we're not a for-profit. We're not, pay-driven. And so that allows an incredible ability for biomed engineers like Moti and folks to really look at those innovative technologies like AI technologies and do it right. Virtual reality and extended reality is kind of one of those big portfolios that you see has been able to grow organically. And what that leads to is VA actually is able to influence the industry, meaning that we are able to influence design for veterans, but design for healthcare in general. So we have a responsibility to doing that the right way. It's something that a lot of us veterans don't see or hear about, but it's really, as a veteran, it's really freaking exciting to talk about because we are doing some really incredible, innovative, and technology-based things in VA. And I agree with you. The perception of disability is, it's the same thing as person first language. If you ever heard of it, just because you're rated and have a service-connected disability does not mean that you are disabled. I do whole educational courses on person-first language and disability advocacy and all this stuff. But understanding that if you are 100%, that does not mean that you are incapable of doing things. And that is what a recreational therapist really highlights, is that you can do all the same shit. We just may have to adapt some of this stuff to better suit those needs to protect those conditions that we're trying to work on or improve. So I thought that was a great call out, and I really appreciate that.
I was gonna say, here we go. If you're talking, Ursula,
Okay.
you are.
Okay. For some reason, I was muted, and I'm new to Discord, so navigating it is. I see everybody smiling. Well, Donnie, anyway. Yeah. So regardless, yeah, I asked about the whether you needed to get TRICARE if you were 100% P&T. I've seen online that some say that you are automatically enrolled in TRICARE, and some say you're not, and so I don't know what is.
If you're
the deal.
the thing is, if you're eligible for it, the VA is not going to give you the Champ VA. So TRICARE, let's say it like this. So I do a lot of transitioning veterans out. When you transition out of so TRICARE works like this: as an active service member in the DEER system, you have care. Once you hit the EAS date, TRICARE or DEER system drops you from their active roles. You have to not apply, but reaccess restart, I guess is the best word for it. Basically say,
That's
hey,
what
I'm,
you're talking about. Yep,
I'm
sign up
retired.
for it.
Yeah, I'm
Time of the
retired.
year.
Yeah. So that in that aspect, yes, you're automatically in their system. You just may not be active, I guess, in their system is the best way to put it. Because once you, it's just a rollover situation where sometimes what happens is if you're an active member who just retired, you get off active service, your spouse has to go out and get a medical thing done with her or the child, and excuse me, him or her or the child. And what'll happen is they'll go there and they're like, oh, you don't have coverage. Well, you have to call TRICARE East, TRICARE West, whatever, and reestablish it. But yeah, so if you have that eligibility, you're not going to have the eligibility for Champ VA.
You would just have to re-enroll as a retiree, and then depending on what you wanted, whether you want to go TRICARE Standard or TRICARE Prime, and how it correlated with your benefits would just depend.
What I talked about determining the best way to go.
I'm happy to answer any questions that you have with it. I'll send you a DM, and then I can also link you up with some of our folks. We have a good partnership with Humana. They're not going to tell you one way or the other, but Humana is currently managing TRICARE. So if I can't answer the question, then they should be able to. But I'll shoot you a DM.
Awesome. The other question I had was, who do you talk to? Who is it that determines what is covered under post 9/11 GI Bill, as far as what kind of schooling is eligible to be
There's
covered?
actually a website. So if you go to, I forget the website is, but what you can do otherwise, you can call up. There's a 1-800-827-1000 number. It's a general benefits number. There's also an educational number you can call. But typically, or there's a website. I can't think of the website name. And the website literally will say what I think is like chapter 35, chapter 31, whatever chapter you're using in GI Bill's 33. You can go to a drop down box and it'll list like you already type it in, one of the two, and it'll list like what schools are covered underneath that. So if your school's not listed, then it's not covered. But that's one way to do it, or you can call the educational line, which I can grab that number for you if you want, and they can tell you.
Yeah, that'd be cool. I tried to find a number that would, direct me in that take me in that direction. I couldn't find anything, so.
Yeah, and Aerosol, we also have a education specialist that I can link you up with. So,
oh, cool.
So make sure you mention that as well. So,
you want to drop it in there? Or you just want to hook them up with that? I mean,
yeah, I'll just drop my email and you can just reach out to me.
One of the avenues I'd like to go is hypnotherapy, and I was hoping to offer that to vets at some point. So, but I just need to know that that's covered.
How long you been out?
3 years, 4 years,
3 years. So you can also try the voc rehab route, right?
Already done that. I'm doing that now. I'm getting a master's degree through that.
Okay.
Are you getting a master's degree in a health profession?
Sort of psychology.
So I would potentially make a non-VA personal recommendation here as a health provider is to leverage that degree to get you that training versus like a post 9/11. Because you might find that whoever you get employed with might actually pay for that. So just keep an eye, and again, you can reach out to me and we can have a deeper conversation on how you might navigate that, because there are a ton of grants out there, and the only thing I would say on the personal level is to avoid using your GI Bill for like a smaller certification, and save it potentially for future family, or if you want to go back for your like PhD or something like that. Because in the medical professions, a lot of the companies that employ you will pay for you to get that education because it's required. You have to maintain a certain amount of continuing education, and that can technically you can submit for that and get approved for that. And I've done that through lots of certifications through my profession.
Very cool. Thank you. If we could talk, I'm not sure what your contact information is.
Yeah, I'll drop it into the chat again.
Awesome. Thank you very much. Of
course.
Wanted to jump on the dental question. They said,
yeah, I was going to say that.
I can't even find it now. Is it 100% rating veteran becomes eligible for dental, VA dental? So yeah, that is 100% rating. You can have VR and E. There's aspects of VR and E. VR and E gives you aspects of dental as well. If you're within the 1 year window of, 6-month window of your ETS EAS, there's some VA benefits for dental there, to where they'll bring you in, do a screening, see what the military didn't fix, and fix that. There's some, if you're homeless, there's some dental benefits. If you have a service-connected disability associated with some aspect of your mouth, there's dental benefits. 100% total, 100%, not total and permanent, just 100%. That's non-temporary. And what that means, if you're TDRL, you're not eligible for it, or if you're TDIU, you're not eligible for it either, because you have to. Excuse me. Nope, I take that back. Not TDIU. It's goodness, what is it called? Convalescence. When if you have a surgery, that's service related surgery, and you have the rehabilitation time is up to a month or more, they'll give you they'll pay you at the 100% temporary for those time frames. And in that case, you can get paid up to 3 months for I think it's called convalescence. I could be wrong on that word, but it's up to 3
Chapter 4 convalescence.
Okay, so it's up to 3 months, and then after that 3 months, if it's still more is needed, you can get it. I'm not going to say renewed. You can get it extended for up to another 3 months, but it has to go through a provider to do that part, whoever your surgical team is or whatnot. So yeah, there's more avenues for dental than just the 100%, but it's very select and very I would rather not have dental than be homeless, and I don't mean that in a negative way. I'm just saying, like, there's different ways to get the benefit, but 100% is probably your more assured. One thing I wanted to say while I was here, and I got some. I know there's one person not far from Spring Hill, and I know there's somebody in Ocala. May 8th. At 5 p.m. at VFW Post 10209, which is in Spring Hill, there will be a VA town hall on PACT Act. I'm actually the outreach coordinator for Tampa in the local area, so I'm using the VFWs to push out a lot of PACT Act stuff. And May 8th, you guys are all, if you're in the local area, please come by. There'll be a provider there, and they'll be actually discussing PACT Act elements and how they, they'll be looking from the medical side of the house. There'll also be several VSOs associated with it, and from the VBA. But they're not called VSOs in the VBA; they're called something else. But they can do claims, and there's also be some state and county VSOs there as well, with other VA stuff there.
Donnie, what post was that? I'm gonna type it out.
10209.
10209. There you go.
No, thank you. Do we miss any questions? I know the claim stuff. Can I call you something besides VSO?
Yeah, my name is Keith. I'm the Assistant Director for Training and Quality Assurance for the National Veterans Service. For VFW.
So how do we get a VSO in our post?
You probably won't get a VSO in your post, but we have VSOs that are local to that area. We have on VFW.org a listing where you can search by your zip code, and that'll link you up to the local DSO or ADSO or VSO.
So how do you become a VFW VSO in the local area?
There's accreditation program. Some of them can be volunteers depending upon the department. But if you are interested in being a VSO, we can get you through an accreditation program. It just depends on whether it's going to be paid or a non-paid position.
What if you just want to do a volunteer because you're already paid by the VA? These are just hypothetical situations.
Yeah. You can definitely look at it. We're always looking for more help. We always need more. So
I might message you if that's all right.
Absolutely.
Oh. Conflict of interest. Oh, well, I might retire.
Yeah, as a VA employee, you might not be able to, but there's some ways around that sometimes.
Hey, Donnie, Total Red asked a question here. I know the answer is yes. It's a short answer, but basically, if the discharge is upgraded, do they then become eligible for the benefits again? Short answer, Total Red is yes. and I would highly encourage you connect with the VSO guys, VFW, to help you with that discharge paperwork, submitting for upgrade. I don't know if you're Navy, Marine Corps, Army. Each one has a little bit of different process, and so, but highly encourage you to do that and connect with those folks so they can help you with that process. But yes, you'll be eligible once that happens.
Yeah, that was perfect. I mean, how long did you get out? 2011. So what branch were you? Army. Yeah, I've heard of a lot of people trying to do it. I've heard of very few successions, but I mean it's all up to like growth of the individual and how the from what I understand of how it goes is you have to show growth and understanding and hey, when this happened and this is what I've done with my life since then, and X, Y, and Z. So they want to see growth and stuff like that. So I don't know what the American Legion tells you, but I'm sure this gentleman here can assist you more.
So there's a organization called the Veterans Consortium that I'll send you a link to. There are a bunch of pro bono lawyers that you might be able to utilize to go ahead and get that upgraded. So I'll send you a link to that, Total Rad.
Here you go. They got a question for you here. Just got in. I've been waiting since July, since last year, for my claim to get finished. Finally getting my CMP exams. And another sentence that got added. Finally waiting to get my CMP exams. I've never heard a second exam for one part of a claim, but I'm getting a second one for my PTSD. Is that normal? Is it a good thing or a bad thing?
Yeah, Emerald, it's not uncommon for some conditions to get a second claim, especially if they decide that under VA that there needs to be a medical opinion to clarify something in the previous exam. So that's not a bad thing. Some conditions, depending upon how long you've been out, may not warrant a VA exam because there is sufficient evidence in your case file or your medical records already to allow the VA to rate appropriately. If it came down to a decision and they rated you at 0, which is service connected and it is a rating, but you think that you should have a higher rating because there's pain involved and so on and so forth, then we would move forward and appeal that either through a higher level review or a supplemental claim. But if your claim has been pending, depending upon what was claimed and what the level of the backlog was, it's not too uncommon to see it going for 10, 12 months. I would highly recommend that if you don't have a VSO, whether it be us, the DAV, the American Legion, somebody who's accredited, establish representation with a VSO, because we, at least all VFW VSOs, have access to the Veterans Benefit Management System. I can look into VBMS and see what's going on with your claim and see if there's any holdups that we could reach out and get those things squared away. So if you don't have a representative and you want to establish representation, send me a DM. We'll get you taken care of, and I'll either link you up locally or I'll link you up with my DC office because we work everywhere. So
DD, for the horrible CMP doctors, one doctor went past my point of pain. Didn't use, I can't pronounce that word, not gonna try. Was very
the gonanometers, yeah.
So is that something like a higher level review could take care of, or how would she approach that if she felt?
So it'd be a higher level review and an appeal for her rating decision. But I'd also want to get the name of the doctor so we can report that up to OIG and OGC, because right now there's a lot of review going with the contract med, so that we can push that up for any veterans having issues with, especially if it's a trend with that doctor.
So question on that, because like you said, this is an ongoing comment that I've heard about bad contracting doctors. So if there's an issue with them, they can report them via the VSO, or
they report them via their VSO, and the VSO generally, if it's a Veterans of Foreign Wars VSO, it'll come up to my office, and then we contact OIG with the information, do fact finding with them, and then send it up. They can also put into the survey, or they can contact the contract examining agency themselves or make a complaint against that doctor if they want to have something go to the company as well. But for your case and for your appeal, we want to know about it so we can push it up to OIG and OGC, and then we also want to gather the data in order to make an effective appeal.
Awesome. That's good information to know for everybody, actually. Because I'm glad. Like I've heard a lot of issues where people, and I've never been able to understand like where they would go from there. But that's awesome. Good.
Yeah, I mean we can do a higher level review and base it on an insufficient exam, and then also request that it doesn't go back to that contracting company. So they would hopefully get a different doctor.
Now we wait for these two to type off.
So underneath 38 CFR, the way that the law is written, they just need to send you to a medical practitioner who is able to provide an exam for that. If you as a veteran have a disability benefits questionnaire that's filled out by a specialist, your own primary specialist, and I highly recommend submitting that as evidence as well, because sometimes you might get sent to a nurse practitioner or a general med or an internal med when it's a ortho issue. And when it comes to the hierarchy of evidence, your specialist, especially if they're an orthopedist and it's a knee issue, is going to outweigh what a nurse practitioner should say in most cases. So sometimes it is just who is up in the barrel for that contracting agency for the next round of exams. But we are trying to get them to clarify that if it is a specific issue that requires a specialist, that they do send you to a specialist. That's going to take clarification in the 38 CFR and also the M21, and how their contract is written with the different contracting examiners.
Buckets, Lauren, I must have missed your question. I don't see it. Oh, wait. Why does an unverified report of death get actioned on before any verification?
I've seen this happen a few times where, for some reason, either through Social Security Administration, there's a computer hiccup and a veteran gets declared deceased. It actually happened to me with DFAS, where they decided that I was dead, and I had to work through DFAS to get retirement benefits reestablished. But they have to take action on any report, and one of those things is that they do suspend benefits until they can verify. But once they're able to verify that you are not passed or deceased, everything is retroed back to that date. So.
Well, at least it was a false report, though, right?
Yeah.
That's the upside of that one.
Yep.
All right. I will say, so I don't know if y'all are scheduling us for 2 weeks from this one again, but if so, we're gonna have to skip a week because May 9th, we are doing a live Q&A with Medal of Honor recipient Ryan Pitts, and that'll be on the regiment Discord. And then we can jump over to, I guess that's May 16th. That'll be the next one. We can come back if you guys like. And if you guys want something else aside from my face staring at y'all, I can do another. Let's see, we've done peer support. I can do a women's clinic. I can do, just whatever have you, whatever benefit you really want to know more about. I can get a subject matter expert in here to yap with some and talk to you some and lighten it up besides staring at my ugly mug the whole time. But if Lynn and y'all want to get together and think of a topic, we're trying to work on something for like home loans right now too, trying to get a subject matter expert from there. Now, only reason I would say as long as I could talk to the Strive Thrive group, the only reason I would, as long as it's something that is nationwide, kind of like something going on, I would be okay with that. only reason I would not want it to be specific to Tampa is because that's kind of limiting the reach of that program. I would want something that everybody could access in some way, shape, or form. But if that's something, if that's something that we could do, maybe make it more. Okay, if it's growing national, I can get it on here. That's cool. That's not a big issue. I just don't want it to be something that's specific to one facility. Do you know the point of contact down there for that? Maybe I know them. Nope, don't know that name. Okay. I can reach out. And I'll see if there's something. If it's something national, I can see if they'd be maybe want to do an event like this with it. But we can do whole health. I mean, there's a whole slew of things. If you guys want to get together and discuss it later, get back with us. And I think whole health is a pretty cool thing, just because it's alternative medicines, just like rec therapy is. Alternative ways of treating, things over and over. Yeah. So they do stuff like yoga, acupuncture, stuff like that. So, but yeah, feel free to let me know if there's anything else or anything more or whatever kind of topics you want to do. You guys have your own VSOs, so the CMP stuff is, you got your gentleman right here and all the other ones that kind of, I'm sure that it's just you or there's more that come on here.
I'm the primary on here, but as I get things, I either handle it myself or I'll farm it out to our local VSOs. So some things I can handle pretty quickly.
All right. All right. If DD, I'll see what DD's typing, and after that, if you guys don't have nothing else for us, we'll call it a night, and we'll see you guys again in a few weeks, and we'll get something more. Oh. That's more for the VFW Discord guys. See, the VA email worked. Just Dee, just a heads up on that VA email is pushed out through the office that we're working out of. So that's good to know. Oh, cool, awesome. Glad a few of y'all did. Very cool. That was the whole premise of it. Awesome. Oh, look at that. So that's 3 commander chips that somebody owes me.
Yeah, and I'll just share with you folks that information where you get it being reported to Donnie is extremely helpful to continuing this outreach and justification to keep doing the outreach. So if you guys ever do get referred through those emails, please let Donnie know. Please let us know that. That just continues to show that we're able to reach the right folks.
But back to Didi's thing. I think yes, this is a Discord with a gaming focus, or with a veteran focus with to gaming. I guess is a good way to say it. It's an all encompassing thing, but it also has a big gaming core to it. But again, we thank you, Evan, again for taking your time out. Much appreciated.
Always, man. Thanks, folks, for letting me blab my mouth about rec therapy.
Nothing else. I will say goodbye and good night. So thank y'all.